Thursday, August 20th, 2026. I'm Dr. Deukmedjian, CEO and founder of Deuk Spine Institute. Our patient travels to Florida to Deuk Spine Institute with thoracic pain. He has 4 herniated discs in his thoracic spine that we believe are causing his pain in his thoracic area. He's had this thoracic pain for 20 years. He's a doctor. He had to stop practicing medicine because he could no longer do his job. The thoracic pain was so severe. It would put him down for days. We did an MRI review online, and he had herniated discs, many of them. We identified 4 of them that we think are causing the worst symptoms. So we're going to go fix 4 herniated discs. I'm going to start by going on to the T10-11, 11, 12. Everyone agree? Left side, T10-11, T11, 12. Yes? Yes, sir. All right. So if you have questions, feel free to ask. In the meantime, we're going to get started. Shot? All right, T12, T11, T10. So I'm right there at T11. I'm doing 10, 11, 11, 12. Everybody agrees. Shot. All right, let's go with a shot, lateral view. Let me have another needle. Come on, come on, come on. Shot. All right. If you have questions, feel free to ask. Shot, I'll do my best to answer them for you. All right. Meanwhile, we're going to get started by placing some needles into the spine, specifically at T10-11 and T11-12. Shot. Shot. Sometimes this takes a few minutes to get it right. Shot. Shot. That looks good. Shot. Shot. When I say shot, I'm actually asking for an X-ray picture. Yeah. Shot. He's a little light, AP. So 2, we're in good position on 2. I'm going to get ready to do the next one in just a moment. Those are perfect. Perfect. You can see 10, 11, 11, 12. Jordan, you agree? 10, 11, 11, 12. Luis? Yes, sir. All right. So we're going to gain access to the 2 painful discs on the left side, T10, 11, T11, 12. I could feel the tears in the back of those discs. Move north. All right, so if that's 10, 11, that's 10, 9, 8, 7. The next one we're doing is, no, stay on the lateral view. Oh, if you can. The next is a left 7, 8. So that's 10, 9, 8, 7. I see 7, 8. Shot. All right, 10, 9, 8, 7. I see 7, 8. One of the hardest things about thoracic disc surgery is getting the right level. 10, 9, 8, 7. 7, 8. All right, I think that's looking pretty good there, Jordan. Let me just see. Sean? If you have questions, feel free to ask. I'll do my best to answer them. Sean? 10, 9, 8, 7. Sean? I may have to go a little bit more north. North is towards the head. Cephalad. Let's show the audience. Is there a video on the causes of thoracic pain? Anthony?
Yes, we do.
Let's show them that.
Disc injuries start with an annular tear, damaged nucleus. Pulposis herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
What? I don't care about the EKG lead. No. I just need to get the orbital picture proper. I think, I don't know, Jordan, what are you thinking? That's probably good. I mean, I think we're still off. Yeah, I think that's better, right? Sean? 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 Try to get rid of my hand off of the view. Sean? AP? To medial. All right, back to a lateral. Shot. 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 Shot AP. I'm getting caught on the facet, I'm pretty sure, or the transverse process. Yeah, it's probably the facet joint. Let's go back. We're almost there. I have to make a couple of small adjustments. Lung fields look good, Berndes. Shot. Just about there. Shot. Shot. Shot, there it is. Just felt it go around. Shot. Shot. AP. We're almost there. These are the hardest discs to get to. AP. Yeah, almost there. It's really nice. 10, 9, 8, 7, 6. Let's see, we're doing 10, 11, right? So it's 10, 9, 8, 7. So it's 7, 8. 7, 8 is correct. Left 7, 8. Everybody agrees? All right. Let's see if I can get past this thing. There it is. Wow. Just the most half a millimeter of movement makes the biggest difference. It's absolute precision. We're inside the disc. Last one. We got 4 discs in the thoracic spine that are herniated, that are causing pain. Shot. All right, I think we're off on orbit. You see it? It's maybe worse. That's probably better. What do you think, Jordan? That's a tough one. Yeah, just a little bit more maybe. You could see the scapula there. Any questions? Sean?
No questions.
Sean? 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 AP? So once we're done here, the burn does 2 minutes, 3 minutes, maybe 5 at most. We're going to do a discogram, folks. And what that is I'm going to see if these discs are indeed causing the patient's pain that he gets every day. We call that an evocative discogram. It's the very best test that a doctor can do to confirm the discogenic source of pain. So that's what I intend to do with him. All right. Aiming for that disc. Just hitting up against an arthritic facet. That's really the problem. There we go. Sean. Sean, AP. Did we show the audience the 30 causes of pain?
No.
Well, let's do that. I'm Dr. R. Deukmedjian with the Deuk Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Deuk Laser Disc Repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Deuk plasma rhizotomy of the SI joints offered at Deuk Spine or Deuk Joint Institute. The fourth most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Deuk piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Deukmedjian. Thanks for joining us.
1.
Welcome back. You can see from our video that back pain has many causes, but the causes are very specific. We know every cause of back pain here at Deuk Spine Institute. More importantly, we can diagnose what's causing your back pain over a Zoom call that takes 10 minutes, as long as we have your MRI scan or CAT scan. We offer that as a free service. This patient is from the Virgin Islands. He's here because he's had 20 years of back pain, all here in the thoracic spine. When we did his Zoom call, I found that his MRI showed multiple disc herniations. They were not big ones, they were small. We call them annular tear with bulges. Had a little degenerative changes, but I believe that his pain was coming from a combination of 4 discs plus the facet joints. So we're treating all those today. Are you awake?
How are you doing, my friend?
Are you having any pain? Huh? No. Are you comfortable?
Are you comfortable right now? He said yes.
Now I told him we're going to wake him up during surgery for a brief moment in time. We're going to test the discs to see if they're painful. Are you having any pain?
No.
How bad is that pain on a scale of 1 to 10? What's the highest?
You got a number for us?
How high does it go?
What number? 4.
What's the highest it goes? Does he still have narcotic on board? Is that where you get pain?
I'm sorry, what did you say, yes or no on that? It's
Ask him the highest it went. What's the
It
highest?
went was what on the pain score? 4.
And is that where he gets pain?
Is that where you get the pain normally? Yes or no? Yes, he said yes.
All right.
He's responding.
All right. Is it better?
Is your pain better now? Yes or no?
He's just waking up from being asleep. I have a feeling he still has some narcotic on board. But it's concordant. That's what matters. Are you having any pain right now?
Any pain, sir?
No.
No.
Leave it.
Oh,
No pain.
no
Good.
pain.
How bad is that on a scale of 1 to 10? What's the highest?
4?
I couldn't hear.
What number did you say? 4 again.
All right. Is that where you get pain?
Yes.
All right.
So we got 2.
Are you okay? You having any pain?
Are you having any back pain now, sir? Any pain?
Lay still.
Gotta keep your arm still. He says he's on the left side, he's still pain.
All right. How bad is that right there on a scale of 1 to 10? Shot.
4.
Shot. Is that where you, how bad is that on a scale of 1 to 10? 4. What's the high, is that where you get pain?
Yes.
How bad is that on a scale of 1 to 10? Shot.
Give us a number. About a 4.
Is that where you get pain?
Yes.
All right. Well, at least we found your source of pain. Maybe it's not bothering him too much today, but we're going to put you to sleep. When you wake up, we'll be done. All right. We just tested the 4 discs that we're going to fix today with laser spine surgery. And he said all 4 discs were 4 out of 10. That's the highest it went. Now, that said, we do give our patients anesthesia, so he's just coming out of the anesthesia. And his response may be related to the anesthesia. But the important thing is he did get pain when we injected a little dye, and it was concordant, meaning that's exactly where he gets his thoracic pain. So we're going to do the procedure, and hopefully it's going to fix the pain permanently for him. If you have questions, feel free to ask. We're making a 7mm incision. Shot. Let's show the audience how disc herniations can become so painful.
Disc injuries start with an annular tear, damaged nucleus. Pulposis herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
You can see from the video that an annular tear can result in a herniation, which then causes inflammation. That inflammatory pain is highly localized and causes thoracic pain. In his case, it was so bad he couldn't do his job. He had to quit medicine. He was a doctor, still is a doctor, but he can't practice. So he's here hopefully to get relief. And we're going to start with the T11-12. We're going to enter through the tear in the back of the disc. I'm going to take it out. I'm going to go in and use a laser to clean the tear. And that should help him with his back pain. Should get rid of it if it's coming from the disc. All right. Any questions?
Yes.
John?
We have a question from John on YouTube.
Yeah, John, sure.
Hi, Doc. What are your thoughts on massage therapy? I had a laminectomy and a 3-level ACDF surgery 4 months ago. Physical training, physical
is it so
therapy
low?
isn't doing much for me.
Yeah, so to answer your question, is therapy good for you after spine surgery such as laminectomy or fusion? The answer is yes. Therapy is always good for patients. It won't get rid of your pain necessarily. It really depends on where the pain's coming from. Most people that have pain, I need the scope on. Most people that have pain after surgery have pain because either they have a muscle pain or they have joint pain. if your pain is joint pain, it will not go away with therapy. Grabber, laser. Okay, we're starting with the T10-11. Yeah. Well, that's good. That means that we're in the right spot. We put lidocaine marking, correct?
Doctor, I just want to let you know that I found two scopes.
Are they the scopes we typically use?
These ones, yes.
Lumbar?
Yep. And I'm gonna make
The right ones?
Oh yeah, the same ones.
How much the?
Huh?
Yeah, we're using a lumbar for the bottom two because they're close to the size of a lumbar disc. But we're using cervical for the upper ones. And the reason is because the upper ones are actually, the passage to the disc is too narrow for a lumbar scope. You know, the rib and the transverse process and the facet create a very narrow opening that I need the cervical size to get through. Anyway, how much are they asking?
So they asked for 3,500. I throw an offer of 1,000. 31, 30.
All right, whatever you do, get them.
That's okay?
No, whatever you do, get them.
No, no.
If they say no and they come back at 2 or 3.
They're gonna start counter offer and all that shit, so I'm gonna hope so. I don't know.
That's all right. Are we live streaming?
Yes, we are.
Have we shown the audience how to repair a painful thoracic disc?
No.
Let's do that.
Disc injuries are a common cause of chronic thoracic back pain. The inflamed annular tear causes thoracic back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debreeds the annular tear. The advantages with the Deuk Laser Disc Repair is that it's an outpatient procedure that takes 30 minutes to complete, very minimal bleeding and pain after the surgery with immediate recovery and return to work the next day, as well as a 99% success rate and permanent pain relief with a single treatment. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
All right, welcome back. We're just talking about my son Arias, who's preparing to take the MCAT for entrance to medical school this Saturday. He is currently at Princeton, and I feel badly because I took the MCAT back in the early 90s, 92, I think 92. 1992, which is what, 34 years ago? 34 years ago, the medical school entrance exam really tested you on a few things. Physical sciences, which is physics and chemistry. Biological sciences, which is biology. Are you okay, Berndes? Yeah. Biology, organic chemistry, things like that, biochemistry. And there was a section on writing where you actually wrote an essay, and the essay would be graded by a literature professor, a literary professor. And we had a reading comprehension. So I didn't know the exam has changed, but it has changed substantially to where nowadays If you are really good at the biological sciences and physical sciences, you still could do very badly because they have new sections on sociology and psychology. And there's physiology as well, like the physiology of behavior, they call it, where they're asking medical school level questions. Medical school. Like the answers to these questions, I only learned when I was in my first year of medical school. And they're expecting these students now that are college students taking the medical school entrance exam to know medical school physiology, medical school histology, medical school endocrinology. And I just think it's very, very interesting, very telling that the MCAT is now harder than it ever used to be, basically. All right, any questions from the audience about our surgery?
Yes, we have a question from John on YouTube.
All right, I'll take the question in just a moment. I just want to narrate for a moment. We are currently fixing the first of 4 herniated discs in the thoracic spine, T6-7, T7-8, T10-11, T11-12. This disc that I'm operating on right now is the T11-12. And what I'm seeing in here is a tremendous amount of scar tissue that should not be here. All of this white stuff, it's very, very thick and tough, is abnormal. The normal disc, which is soft and white, it's called nucleus pulposus, is no longer here. It's been just completely replaced by this very dense scar tissue right here. And this is an indication that this patient has had inflammation happening inside this disc for many years, at least 10 years plus. We know from him, this patient, who's also a physician, who specializes in spine care, by the way, that's all I'm going to say, is that he's had pain in his thoracic for over 20 years. So the fact that he's got scar tissue that looks like it's 20 to 30 years old does not surprise me, because he's a very good historian and he gave me historical information that he suffered with this problem almost for over 20 years. So what I'm saying to you is that the pathophysiology or anatomy that I'm seeing, pathoanatomy inside this disc, all this scar tissue, is consistent with the history of 20 plus years of thoracic disc pain. So we also did a discogram earlier. We confirmed that this disc was painful. Yes, I'll take the question.
Yes, so John on YouTube asks, if my L5-S1 laminectomy failed, can this procedure correct it? Good luck to Arias.
Oh, thank you so much. The answer to your question is yes. We can, let me make it very simple, John. If a patient has back pain or neck pain or thoracic pain, so pain coming from any part of their spine, we can fix the pain completely. There was a time, and there unfortunately still is a time, where doctors would tell patients with back pain and neck pain, we're sorry, we can't do anything to fix it. All we can do is pills, shots, therapy, chiropractor, physical therapy, and a fusion surgery in the worst case scenario, if there's deformity, all right? Times have changed. We now know what causes back pain. As you saw in the beginning of the surgery, there are 30 specific causes. Deuk Spine Institute can fix 28 out of 30 causes, which is we don't treat tumors and we don't really treat infections. Those are the 2 out of 30 causes we don't really treat. Now, it's not entirely true. I can take tumors out. It's just that those patients are better served in a big university hospital where they have access to oncology services and all types of consult services that can be helpful in managing their tumor. Same thing with infections. There's a lot of people in the world with tuberculosis of the spine, and we are not really set up to do treatments of spinal tuberculosis, for example. Very common in India, Pakistan, because tuberculosis is rampant in those countries. Suction is not working. Suction is not working. All right, let's get the suction working. We're done here. I'm coming out. We're going to move on to the next disc. I need the dilator, please. Can we get the sucker working, please? Well, guys, the suction is not something that is, I mean, it's not difficult to figure it out. This isn't rocket science, okay? We shouldn't have suction issue. It's working. It's working. It's working now, you know, but let's check the stuff, the instrumentation ahead of time so we don't have an issue, okay?
Scope off, please. Thank you.
Hector, you gotta step it up a little bit, my friend. If I notice you're in the room instead of Sam, that's not a good thing. All right. So, to answer your question, yes, we can fix your problem if you're suffering with pain. I just need to know why you have pain. And I cannot tell you why you have pain listening to you describe your pain. There is no way for me to accurately diagnose your pain without doing an examination of your body. I must see your body. I must see where the pain is coming from. Only then, by seeing your pain and having you show me where the pain's coming from, only then, combined with an MRI scan, possibly CAT scan, X-ray, only then can I tell you why you're having pain. Once we know the why, fixing it is easy. We fix pain every day. The hardest part is knowing why. And the reason I say that is because there's only 30 things that cause back pain, and I know all 30, and I know how to fix all 30. We choose not to fix 2 out of the 30, but the other 28 we fix all the time here at Deuk Spine. So I just need to know why you have pain, and that requires the MRI review. Great question, thank you. Any other questions?
No questions.
Yep. All right. So it looks brutal, and I'm hammering this pointed metal pencil into the disc. I'm hammering it right through the annular tear where all the pain comes from. It's a torn ligament in the back of the disc. Should not be torn. Supposed to be intact. We call it intact, meaning not torn. It's 20 to 25 layers of collagen and elastin. It holds the jelly in the center of your disc. And this patient ripped that ligament holding the bones together, ripped the annulus apart, at the same time crushed the nucleus into fragments. And over his lifetime, those fragments have been coming out and stirring up inflammation in the back of the disc. That inflammation is what's been causing his back pain. And every time he went to work and took care of patients, he would herniate some more disc material out, and that would cause a new cycle of pain. There's the inflammation right there. You guys see the red stuff? That is the inflammation. Take this. So I got to go get rid of that inflammatory tissue. You see the white, you see the blue, you see the red. Red, white, and blue. Very patriotic. So the white is either scar tissue or annulus fibrosis or nucleus pulposus. The pink red is inflammatory tissue or blood. And in his case, it's inflammatory tissue. The blue is degenerated nucleus pulposus. And the reason there's degenerated nucleus pulposus is because he has inflammation happening right here that is getting onto the nucleus, the herniated nucleus, and causing it to stain blue when we add the blue dye. I hope you guys understand that. Without the blue dye, there is no blue. We inject the blue dye when we do the discogram. However, the blue will only stain a herniated disc when that herniated disc is degenerated. So if you have a fresh herniation, brand new, just happened in the last week, it will not stain blue. It will be white. When you have an old herniation that is degenerated, it will stain blue. And when you have a really, really old herniation that's all scarred up from inflammation, then it'll be white again. So white, blue, white, different phases. But this is where his pain's coming from. We already know that. Any other questions?
No questions.
Now, we don't get a lot of thoracic disc herniations coming here to Deuk Spine because most people don't have thoracic disc herniations. The thoracic spine is stabilized by the rib cage. The ribs provide excellent stability and support. So thoracic injuries and thoracic symptoms are very uncommon. Only about 2% of our patients that come here with pain have thoracic pain. About 60%, 70% have lower back pain. And another 40% or so have cervical pain, neck pain. So vast majority of our patients are neck and back. Very few are thoracic. But thoracic injuries do exist, and these patients have a really hard time finding help from the medical system because doctors don't know how to fix thoracic pain. As a matter of fact, I started doing the Deuk Laser Disc Repair for lower back pain and neck pain 20 years ago. But I would not do thoracic pain at the time because it was too risky. And I told the few patients I saw that had thoracic pain and herniated discs, I said, I don't know what to tell you. I can't help you because I won't do the laser surgery on the thoracic spine. It's too risky. I held off for many years until I had one patient who was involved in an accident, car accident, and he had cervical disc herniation pain, lumbar disc herniation pain, and thoracic herniation pain. I fixed his cervical, I fixed his lumbar, the pain was gone. He was so happy at the time, but his thoracic continued to hurt him. And we did shots, we did therapy, chiropractic, massage. We did everything. We tried everything we could. Stem cells, PRP. And he came back one day and said, I can't take it anymore. I don't know what to do. I may just kill myself. And I said, don't do that. Don't do that. I will do your surgery. But you may die from my surgery. And he said, that's okay. As long as you try. I don't mind dying. I just can't live like this. So I had a really long discussion because I was really worried that he would die from my surgery. And I did my first thoracic and Deuk Laser Disc Repair that day. And we got through it without any problems. He came back the next day. He said the pain is completely gone in my thoracic. And he was crying, thanking me. And that moment on, I decided that it's better to have a complication from this surgery and even possibly kill a patient if they choose that. I can't choose that for them. They have to choose that. But it's better for me to help them than to say no and just let them go and kill themselves. So it's back pain is real serious. I mean, I don't think it gets the attention it deserves in the world, especially in America and other countries. People with back pain are looked down on. That's only because the system has failed them. The system does not diagnose their pain properly. The system tells them they're liars and babies and weak and wimpy, but they're not. They're suffering with one of the most painful conditions in the world. As a matter of fact, My chairman, Dr. Friedman at Shands, once told me discitis is the most painful condition in the world. Okay, besides trigeminal neuralgia. There's nothing more painful than discitis. Discitis is inflammation of a disc. That's what we're treating. Inflammation of the disc, discitis. So I took that to heart, and I realized these people are truly suffering and I can fix them. So that's why we do what we do here at Deuk Spine. We take risks, but they're measured risk. They're calculated with the goal of helping people live better lives. All right, we're just about done. You can see the end of the tear right there. You can see some more pinkness. That's inflammatory tissue. That's where all the class 4 nerve fibers are, the unmyelinated nerve fibers that cause pain. I'm going to move on from this disc up to T7-8, right? Is it 7-8? Yeah.
Yes.
And then we're going to do 6-7. Any more questions?
Yes, we have a question from Fear of George on YouTube.
Fear of George. That's an interesting name. I'd be happy to take the question from Fear of George.
Are all your surgeries for discogenic pain? What about sciatica, lateral or central stenosis, or neurogenic claudication due to ligamentum flavum hypertrophy?
That's a great question. No, all of our surgeries are definitely not for discogenic pain. Just most of them are. Probably 75% of our surgeries are for discogenic symptoms. But this patient also has facetogenic symptoms, so we're going to be treating his facets next. The last patient we treated before we came here had sacroiliac joint pain, so we treated his SI joint. And we're going to be performing facet joint treatment next. Then we're going to do, like I said, an SI joint. So you'll get to watch that. We also treat stenosis, lateral recess, foraminal. This surgery you're watching right now is the best treatment for lateral recess and foraminal stenosis. There is nothing better. And that's why we do it. We just talk about back pain because most people believe that back pain is uncurable, but it isn't. See it, Luis?
It's not on the top.
Yeah.
I think it's a movement of the camera.
There may be water or something in there. All right, any other questions?
No questions.
All right,
We done with that?
why don't you take a look at that? We're done. We're going to move on to the next disc. We've completed 2. The patient asked me before surgery, will I get better? And I said, I'm very confident you're going to get better. I just hope you're
Two on, please.
cured
Two on.
completely. Time will tell. All right. Any other questions?
No questions.
Give me- Okay. There's a piece of herniation there. Do you see that, Anthony?
Yes, I do.
And the whole thing was done through a 7mm incision. So we fixed 2 discs, 2 7mm incisions. I put a little pressure on the muscle because even though we don't cut the muscle, sometimes there's a little bit of bleeding from the muscle, so it's good to put pressure. That way you don't get a little hematoma or blood clot in the muscle. Let's bring the fluoro in. We're going to move on to the T7-8, and then the last will be 6-7. We're also going to treat the facets. Do we have num-num? Come on in. Any other questions?
No questions.
We're going to go to the smaller scope, right?
Yes, sir.
Shot, is that it?
Yes, sir.
Shot? Mm-hmm. All right, the next scope we're using is our smaller scope. Unlike the first scope you saw, it is not a rod lens type scope, it's a fiber optic scope. So the image is going to be a little bit different, but still plenty good for surgery. It has 5,000 little fibers that project the image up through the camera to my screen where I can watch it. And here,
Yes, sir.
here. Shot. Any questions?
No questions.
Shot. Take that. All right. Fucking thing. It's out of the way. Shot. I got this. Is the scope ready? Shot. Shot. All right, we're right at the back of the disc. No more questions?
No more questions.
All right. Now we're inside the disc with the tube. We're going to bring the endoscope in. We'll be able to see inside this disc T7-8. The other area looks fantastic. I don't see any swelling of the muscle. If you have questions, feel free to ask. Have we shown our audience all their videos?
Yes, we have.
Great. Dr. B, how's he doing? What's all right? He's a little light? Huh? Grab her. You're mumbling. It doesn't mean anything to me. Huh? Yeah. But he's doing well? No issues. I probably have 15 more minutes on these two discs, and then we can move on to facets.
What's water
Sorry?
on the camera? What's water on the camera?
Yeah, that's what I figured. Thanks. Who's that? Hector? Click it up one.
One more up. One more up, please.
Brighter one. Brighter one. Yeah,
Thank you.
that's it. That's wonderful. Everything's going well for me, Dr. B. I'm happy with our progress here. Personally like the larger scope better, but you know, I do like the small one too. It's just not as efficient. All right, if you have questions, this is the time to ask. Deuk Spine Institute has patients from all over the world. There's a piece of herniation right there. The blue thing. The laser is making quick work of it. As you saw, it broke it up into small pieces. The little pieces flowed out. We have patients from all over the world. We have a map in our waiting room that our patients from all over the world, they put their little pin from where they come from. Some of my favorite patients have come from countries like Dubai, UAE, Canada, of course the United States, England, Great Britain. Keep these things out of the way. Damn it. Why is that still there? Come on, Luis. Everything's falling all over the place. You got to organize your house a little bit. That's better. Is he responding? Berndes? Is he responding? No, I just heard his heart rate change. Huh? Stable? All right, grab her. All right, here it comes. Yes, you are. Thank you. Oh, good. Just about finished with this disc, and then we'll be moving on to our last one. You can see the fibers of the annulus there, the ones that were not torn. You can see scar tissue, calcification, the gold stuff right there, pieces of herniation. I'm pulling the tube back. We're exposing more of the tear, more of the herniation. As I clean parts of the tear and herniation, more is exposed so I can keep going. Some people don't understand that concept, but it's necessary for me to move. Doesn't matter. Either way would have been fine. Don't impede me. Should be the last right here of that herniation. Grab her. Come on, Luis. If I'm putting the machine down there, you got to be bringing your hand over there. Give me that grabber. Come on, you gotta have the right tool ready. Let's go. Roll, 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 roll. I know, but hand it to me. I don't want to have to look for things. I want you to hand me my next tool. That's what you need to do. That's part of the job. All right, come on in, Jordan. All right. Shot. Dilator. How's he doing? Shot. Mm-hmm. Okay. Shot. That's it. Take. Hold on. Okay. Tube. Uh-huh. Good. Good. Top. Shot. That's perfect. I'm sorry?
He tolerates the cervical way better.
Going out.
But that's to be expected.
Great. Thank you. Jordan, multiplanar movement. I love it. Good job. See that?
Very limber on his feet today.
He retracted and rotated all at the same time. All right. Well, folks, we're almost done. So if you've got questions, this is the time to ask. I need my Ray Tech here. Always, always Ray Tech here. All right. Pedal. Kick it over, Luis. Careful, Jordan. Thank you. All right. So we're going to finish this and then we'll move on to the facets. We're going to end the stream. So if you have questions, this is the time to ask. Those are all pieces of herniated disc right there. You see it? We've just created a path of least resistance for the herniations to come out. We just gave it a way out. They've been trapped in there for a long time, under pressure. Why is there pressure? It's called hydrostatic pressure. It's the pressure of water pressure. And the reason there's hydrostatic pressure is because there's inflammation. Have you guys ever seen a pimple? A pimple is not flat, it's raised. It's raised because of hydrostatic pressure. Grabber. There's inflammation under the skin, in the hair follicle or sweat gland, where the pimple is made. That inflammation creates hydrostatic influx of water, and it builds up pressure in the follicle, which then tenses the skin up and gives you the typical raised appearance of a pimple. Well, a herniated disc is not much different. It has inflammation as well, and the inflammation creates pressure inside the disc. Sometimes the pressure is so great, it literally pushes my tools out of the disc. We've seen it happen many times.
Jordan, we're going to need an X-ray. Just so you know. We're going to need
We'll do a quick x-ray while we're getting the facets. All right? Yeah. Are you concerned?
No, not at all, but I want to make sure that we're not forgetting.
Of course.
We're not going to miss that.
We're not missing it.
That's a part of the process that
I agree.
okay. So, you know.
Huh? You do that. All right. Any questions, Anthony?
Yes, we have a question from Virgo on YouTube.
Is it Virgo or vertigo? Look at that herniation right there. You guys see that?
Oh,
It
yeah.
literally just wiggled out of the tear. That's what's causing his back pain. And I just pulled it out. Here it is. You guys see this? Right here?
Yes, we do.
It's tiny. It's about 5 millimeters, but it is significant because even though it's super small, it's in just the right spot. I'll take Virgo or Vertigo's question.
Virgo. His question is, how many discs does this patient have that need to be repaired?
Right? Well, that's a great question. I believe he has 4. I need to grab her again. 4 discs, but I could be wrong. It could be 5 because I'm seeing another herniation at T9-10. Boy, that thing doesn't want to come out. So for now, I'm just going to say 4. Because that's what we're fixing. Now, whether he needs more done, time will tell. But today we're only doing 4. And there's no way I can do more than that. It's a big surgery as it is. All right, you can see the tear right there. It's sort of in the top half of the disc. There is still herniation left in there. I'm going to have to work on getting some of that out. So as I retract my tube, I can sometimes get better access to those herniations and get them out. Thank you, Luis. It is that irrigation line getting in between my fingers. You guys see that right there? This is called the annular debridement. And I'm the one who pioneered this technique. The first in the world to ever do an annular debridement of the disc and describe it and publish it and name it. It's called the Deuk Laser Disc Repair because we're doing the debridement with a laser. It is this debridement that allows us to get rid of the patient's source of back pain. In other words, the herniation, the inflammation, the granulation tissue that's grown into this wound. This is a wound. It's an internal wound. There's a piece of herniation. That's the one we were working on before. Finally got it out. But he has a wound. The wound is in the disc. You see, the wound has been trying to heal for years, but he's not been able to heal it because the herniation is still there, stuck inside the tear. Once you remove the herniation, like I'm doing right now with the laser, then the wound will heal. The annulus seals itself, and the disc heals itself. So we provide at Deuk Spine the only surgery in the world that allows a disc to heal itself properly. Now, some people would argue microdiscectomy, you're removing the herniation and allowing the disc to heal, but it's not true. With a microdiscectomy, the surgeon is only taking the hernia out or he's taking the whole disc out. But you're not allowing the disc to naturally heal. You're actually removing the disc, which is bad. You want to keep the disc there. The only part you want to remove is the part that causes symptoms, which is the tear in the back. I got about a minute left, and then we're done with the disc part. So if you have any questions, this is the time to ask. Otherwise, we're moving on to facets. Any other questions?
No questions.
All right, look at that inflammatory tissue right there. You guys see the pink? Just zapped it away. It's pretty, isn't it? Like a pink and a blue. It's almost like having twins. Opposite sex. All right. Well, thank you for joining us. It's been a pleasure operating with you guys today. Hopefully you learned something new from Deuk Spine Institute and our laser spine surgery. If you have a herniated disc or know somebody, grabber, with a herniated disc, we offer a free consultation to see if they're a candidate for our treatments. Even if they don't come here, that's okay. It's free. So they can get help. We'll give you advice, answer questions, as long as you're reasonable with the questions. We have some people that are a bit unreasonable. They want to ask 1,000 questions in 10 minutes. My favorite is the people who argue with me about my profession and specialty. We had some guy from England a couple of weeks ago who got very angry because I wouldn't answer 100 questions. We reminded him it's a free consultation and that we're really supposed to be giving you a diagnosis and a recommendation to help you get better. But some people are not there for the right reasons. All right. I'll take any last minute questions. We're pretty much done. We're going to end the stream and move on to the facets.
Yes, we have a question from the Ver on YouTube.
The verb.
Hello, doctor. Is
Hi.
it possible to use an MRI scan to verify the results of the surgeries? Surgery to correct a herniated disc 1 year after procedure. Thank you for your response.
Yeah, an MRI scan will never tell you if the surgery was successful. Remember, your spine is always going to be abnormal. So if you're looking for normal, you're not going to find it. We don't do cosmetic spine surgery. We're not trying to make your nose look better or your spine look better. We're trying to make it feel better. Thanks for joining us. We're going to restream in a moment with facets.